Hey Peter, how are you?
I'm very well. Thank
Good.
you.
We've known each other about 2.5 years.
Yes.
And you were sent by a surgeon. You've had three back surgeries, and you had persistent back and leg pain, correct?
Yes, it actually
And
got
so
worse.
You were kind of a medical mystery in that we just couldn't seem to find answers for you.
It seemed everybody got stumped.
Me too, because when I first started treating him, I thought the answer was to put a spacer in. And we did put a Vertiflex spacer in, and I think it was good for a while, but then...
It immediately got rid of the leg pain.
Immediately, right. But then, as not infrequently happens, that spacer slipped out, and that leg pain came back.
I could tell immediately something had
So
changed.
did that last for like 6 months or something, or?
Maybe even a little longer,
Right.
maybe almost a year.
Mm-hmm. So then we got X-rays and MRIs, and we could tell that something had changed and that had moved, because there was no way of fixating that spacer in there. It was just sort of pressure fit. And as active as you are, and as much as you bend and gyrate, this thing didn't manage to slip out. So after trying injections and such, we finally...
We did ablations.
We did ablations, I did Intercept, we tried a whole bunch of things short of surgery. But eventually what I settled on was to actually put a larger implant in here, which grabs much more on the bone and dilates a lot more, because the nerves were pinched on the sides, and by putting this dilating device in here, this InSpan, we're able to open up the inner space and take pressure off the nerve roots. And he had pressure on his L4 nerve roots. And so we did it about a month ago, and it was
to the day, actually.
Yes, the day, and it was a larger surgery than we had done in the past.
Yes.
It was a little more recovery. So would you have like a week or two of some discomfort?
I would think discomfort for about a week.
Yes, because I had to take the old one out and really
by the
dilate
second
things
week,
and
I
put
could
it in.
see that there was some improvement. By the third week, it seemed to kind of completely change.
Reverse, and you felt great.
Unbelievable. I couldn't.
And the leg pain's now gone.
Leg pain has disappeared.
The back pain.
My mobility.
Show me your mobility. That's
Okay,
amazing.
so
That's amazing.
I've not had as much mobility in the past as
That's
I
incredible.
as I have now.
This is amazing. So we did an interspinous fusion with this InSpan device, and it's really opened up the spinal canal. It's opened up the nerve roots, and it's fixated you too. That it's added stability to it.
Yes,
so that's really
definitely.
good.
I had an issue sitting too, so and I have much less pain now when I sit, and not quite as stiff when I get up. So the two issues, the standing and sitting, seem to be something I couldn't solve, and this I certainly have much more mobility.
Well, you look great. You look
Thank
the best I've ever seen you in 2.5 years. So, and I'm hopeful this is going to be a long-lasting
Yes,
answer
hopefully
for you.
next it'll be a visit next to say hi.
Yes. I hope so. So listen, it's been a pleasure to take care
Thank
of
you
you,
much.
and thank you for having confidence in us.
Thank you.
Okay.